Good afternoon. Welcome to the webinar, Investing in Treating Trauma and Reducing Poverty to Address Illinois' Violence Crisis, a data and policy discussion presented by the Illinois ACEs Response Collaborative in partnership with Heartland Alliance's Social Impact Research Center. We'll be live tweeting and the information is below on the screen. So the Illinois ACEs Response Collaborative is described below. While adverse childhood experiences research emphasizes how deeply trauma impacts health outcomes, it also offers a powerful lens to examine public health problems and develop solutions. The collaborative illustrates the power of systems-level cooperation to intervene in the transmission of ACEs from one generation to the next. Our many successes have been grounded in a commitment to a collective impact framework, recognizing that no single organization or sector can build community resilience alone. The collaborative fills a critical role by drawing together leaders from different groups to think more broadly about ACEs and by coordinating our varied efforts to effectively move the dial. By expanding ACEs research in Illinois, learning from effective interventions in other states and communities, and strengthening the relationships among the groups in our state working to address ACEs, we can develop the policies and interventions we need to reduce ACEs and combat their harmful impact on our health. You can visit Health and Medicine Policy Research Group's website for more information, including policy briefs and an environmental scan of trauma-informed programs. The collaborative would like to thank United Way of Metropolitan Chicago for its partnership in this collaborative and the following funders who support our critical work: the Health Federation of Philadelphia, Illinois Children's Healthcare Foundation, Crown Family Philanthropies, Polk Brothers Foundation, and the Otho S.A. Sprague Memorial Institute. We thank Heartland Alliance's Social Impact Research Center for focusing their effort in this year's poverty report on the intersection of poverty, violence, and trauma. This report reinforces much of the work of the collaborative, showing the impact of historical trauma with a lens towards an ongoing legacy of violence and oppression towards communities of colors. It also explores the impact of incarceration, a well-studied adverse childhood experience that has devastating impacts not only on children, but on families and also communities. This presentation will show the wide-ranging impact of poverty, and you will see why some leaders in the trauma field, while not already indicated, consider poverty not only as an adverse childhood experience, but one of the most powerful adverse childhood experiences. The data behind ACEs is a mechanism to link trauma to population health and social justice movements. As we speak, and due to the Illinois ACEs Response Collaborative's advocacy efforts, the Illinois Department of Public Health is collecting ACEs data in Illinois to further add to data sources such as the ones presented in this webinar to inform this report. We will have that data next year to help inform our own policy and practice recommendations. During the webinar, all participants will be in mute mode, but we'd love to hear your comments and questions throughout the way. Please type your questions in the chat box, and after about 35 minutes of the webinar, we'll open up for Q&A and facilitate a discussion. After the webinar, you'll receive an email with a short survey, ways to participate in the collaborative, links to some of our policy briefs and other materials, as well as a recording of the webinar. And now onto the presentation. We are very lucky to have two presenters from Heartland Alliance to discuss the intersection of poverty, violence, and trauma. Katie Buitrago, the Director of Research at Heartland Alliance's Social Impact Research Center, is the Director of Research. Her project included of a major initiative to develop and implement an integrated data system for Chicago region workforce providers. She believes that rigorous and actionable research, coupled with effective advocacy, can make public policy more effective at lifting people out of poverty. Prior to joining Impact, Katie conducted communications, legislative, and regulatory advocacy and research at Woodstock Institute to advance economic security for low-wealth people and people of color. She authored a report analyzing whether students at for-profit colleges were more likely to take out student loans than students at public and nonprofit colleges, and use the findings to inform advocacy to reform the student debt system. Katie received her Master of Public Policy from the Irving B. Harris School of Public Policy at the University of Chicago. Sam Tuttle is the Director of Policy and Advocacy for Heartland Alliance, where she oversees Heartland's work to advance policies that address poverty and inequity. In this role, she provides strategic guidance and support to Heartland's policy team, whose work includes economic security, financial empowerment, and health policy. In addition, Sam spearheads Heartland's policy efforts in criminal justice and reentry, affordable housing, immigration, human service, and the state budget. Sam is a familiar face in Springfield, where she successfully crafted and advanced legislation in a variety of substantive areas, including multiple bills that reduce barriers for people with criminal records, protect tenants and homeowners at foreclosure, and increase protections for survivors of human trafficking and domestic violence. Sam co-chairs the Policy Committee of Illinois Partners for Human Services, serves on its board, co-chairs the Legislative Committee of the Responsible Budget Coalition, and is a founding member of the Restoring Rights and Opportunities Coalition of Illinois. Sam received her bachelor's in Spanish and Political Science from the University of Minnesota and her law degree from the University of Michigan Law School. As you can see, we're very lucky to have both presenters. Now I'm going to pass it over to Katie to start the presentation.
All right. Thank you so much, Maggie, for inviting Sam and me to join you to talk about our latest report on Illinois poverty. It's called this year, The Cycle of Risk, the Intersection of Poverty, Violence, and Trauma. And it's our 17th annual report on poverty. We started really because we saw during the economic boom of the late 90s that clearly a rising tide doesn't lift all boats. So we also heard a lot of misconceptions about who lived in poverty and what the causes of poverty were. We decided that we needed to take a deeper look and drill down beyond just the high-level economic indicators that routinely inform discussions about poverty, and to really document hardship in order to lay a foundation for policy change. Thus, the Poverty Report was born and has served to educate and spur to action hundreds of thousands of people throughout the years. This report is a compilation of some of the best data and research we have at our disposal to understand poverty, violence, and racial disparities in Illinois. Some of the information is from our own analysis of public data, census data, state data, local data, and some of it is from national studies and research. Some of this data are not specific to Illinois. Unfortunately, not all of these sources are available at the granularity that we'd prefer, which is a problem in and of itself. But kicking it off with a discussion of the cycle of risk. First, taking a look at who lives in poverty in Illinois. There's a significant number of people who are struggling with the issues posed by poverty. Almost 1/3 of Illinoisans and 2 in 5 Chicagoans are considered poor or low income. And when we're talking about poverty, we're talking about the federal poverty line, which has not been updated in decades. For a family of 3, it's about $18,000. So we're really talking about extreme deprivation here. Poverty remains at the level, essentially at the level that it was during the recession. In 2010, 13.8% of Illinoisans lived in poverty. In 2015, it's now 13.6%. So even though the recession is over, it hasn't improved life outcomes for everyone. And poverty is also changing in terms of its geographic distribution, both in Illinois and across the country. It's becoming more suburbanized. In the Chicago region in 2000, about 1/3 of the region's poor lived in the suburbs, and now that figure is nearly half of the region's poor live in the suburbs. Virtually all research on poverty shows that people of color are at a much greater risk of experiencing poverty across all age groups and generations. Illinois data tells the same story. Children, women, and people of color have the highest poverty rates. Right now in Illinois, Black children are nearly 4 times as likely to live below the poverty line than white children. That's nearly 40% of Black children in Illinois live in poverty. And if you look at the poverty rate, overall poverty rates by race, you'll see that Black and Latino Illinoisans have much higher poverty rates than white Illinoisans. One of the many misconceptions we hear about poverty in Illinois is that it's a Chicago problem. That's not the case. We took a look at counties throughout Illinois. In downstate and central Illinois, we have many counties that have higher poverty rates than in Cook County, where Chicago is located. And so the isolation that is in rural communities can often compound the issues posed by poverty if they don't have, for example, the same social services infrastructure we have in Chicago. And looking at poverty is really just looking at one measure of hardship. It looks at your income. And if you look at a variety of different indicators of hardship across the board, there's persistent, significant, and racial disparity on every single quality of life domain. Illinoisans of color have poverty rates that are 2 to 3 times higher than whites. They have unemployment rates that are 1.4 to 2.4 times higher. High school graduation rates that are 10 to 15 percentage points lower, are 2 to 3 times more likely to be uninsured for health care, and are 2 times more likely to be food insecure. Differences on a handful of these outcomes would be one thing, but these differences are persistent across every single quality of life domain. And the uncomfortable truth is that we haven't made nearly as much progress on issues of racial equity as we may hope. So in addition to just the snapshot of poverty, what poverty looks like in Illinois, we also take a look at different angles on the issue of poverty every year in our reports. And this year, we took a look at the intersection of poverty, violence, and trauma. As many of you may know, Chicago is facing a crisis of lethal violence, and communities across Illinois, as we just discussed, are struggling with staggering rates of poverty. Our research shows that these two factors are interconnected. The same forces that foster poverty also put people at risk of violence. The lack of good-paying jobs, limited educational opportunities, and the lack of access to key services. And experiencing violence is traumatic. Trauma has negative effects on people's lives, from making it hard to succeed in school and at work to raising the likelihood of aggressive behavior. This further feeds into the cycle of poverty and violence. It's clear that in order to stop violence before it starts, we need to invest in our communities and help people heal from trauma. Just taking a look at the trends in violence in Chicago and Illinois. Despite years of decline in violent crime and murders in Illinois and in Chicago, murder rates in Chicago have dramatically and suddenly risen in the past year. You won't see that on this graph because it only goes through 2015, but if you look at 2016, murders in Chicago grew by 58% and non-fatal shootings grew by 43%. A staggering 764 people were murdered in Chicago in 2016, and we continue to see high homicide rates in 2017. And that violence is not equally distributed. People of color in Illinois are disproportionately impacted by violence. Black men aged 15 to 44 comprised over half of Illinois' homicide victims in 2015, while they make up just 3% of the state's population. In Chicago, Black men comprised almost 80% of homicide victims in 2016, compared to 1/3 of the city's population. And Black people in Chicago are victims of non-fatal shootings at a rate that is more than twice as high as the citywide average and almost 70 times higher than whites. The racial disparity in terms of violent victimization is just staggering in Illinois. And the number of poor people who are living in neighborhoods that have highly concentrated poverty in the Chicago region has grown by 384% since 2000. When we talk about extreme poverty neighborhoods, that means that more than 40% of the people in that neighborhood live in poverty. That means that people who are living in poverty are getting more and more concentrated in neighborhoods that lack critical resources that would help them rise out of poverty. And in many ways, where you live determines the opportunities and threats that you face every day. Neighborhoods that struggle with disinvestment and vacancy often experience more violent crime. And neighborhood-level characteristics such as concentrated poverty and proximity to previous homicides are predictors of higher homicide rates. while the strength of neighborhood social ties and concentrated wealth has a protective effect against homicide. And differences in neighborhood access to social and economic resources play a large role in explaining homicide rates. So this concentration of poverty means that more and more people who live in poverty are at risk of violence. You can see that people who live in poverty are much more likely to experience violent crime of all types. This is national data looking at violent crime victimization. Nationwide, people with the lowest incomes per year experience a rate of violent crime victimization that is over 200% higher than people with the highest incomes. And it's true that people with the lowest incomes across all types of violent crime experience the highest rates of victimization. And violence is an issue in all types of communities. While certain populations certainly are disproportionately impacted by violent victimization, it's an issue in rural communities, urban communities, and suburban communities. And the isolation and disconnection from resources that are sometimes found in rural areas can compound issues with violence. The largest income disparity in victimization rates is actually in rural areas, where the poor rural people who live in poverty are 192% more likely to experience violence than high-income people in rural areas. And the long-term consequences of violence can have ripple effects throughout a person's life. Trauma is the overwhelming consequence of violence, and unaddressed trauma can greatly harm people's well-being, life prospects, and public safety. Responses to trauma, if unaddressed, can negatively impact people's lives in many ways. Research shows that common responses to the trauma of violence include stronger retaliatory beliefs, hyper-awareness of threats, and the belief that the world is an unsafe place. It may normalize violence as a way of solving problems, especially for young people. You may perceive benign behavior as threatening and have difficulty controlling aggression. Youth exposed to violence are 2 times more likely to be chronic weapons carriers than those who have not been exposed to violence. And the biological responses to trauma may lend some insight into why trauma has these negative life effects. The stress response becomes overstimulated while the brain struggles to extinguish fear responses and becomes increasingly sensitive to stress. And these neurological processes interfere with memory processing and the ability to exhibit self-control, reasoning, problem solving, and planning. These effects of trauma interfering with school and work and making aggression more likely shows how untreated trauma feeds the cycle of poverty and violence in highly impacted communities. The research is clear that violence, poverty, and trauma reinforce each other and disproportionately impact historically oppressed communities. And there are significant variations in the traumatic reactions to violence. The negative effects of violence worsen in intensity as the exposure to violence increases. And people who live in highly impacted communities with concentrated poverty, concentrated violence, are more likely to experience multiple episodes of violence. And the specific experiences of violence or a history of traumatic experiences can impact how people react and what their traumatic symptoms are. Research shows that there are differences between whether you experience violence personally versus witness it. People who experience violence are more likely to react with anger and externalizing responses, whereas people who witness violence are more likely to react with depression and internalizing responses. Looking again at the differences between rural and urban responses to violence, rural youth exposed to violence experience similar symptoms. It's important because many studies about traumatic responses to violence happen in urban areas, but a few studies on rural responses found that they also experience anger, dissociation, post-traumatic stress, and violent behaviors. There are also gender differences in the response to trauma and violence. Paying attention to women's experience with trauma is critical because women are victims of violence at a higher rate than men. In the U.S. in 2015, 21.1 women of every 1,000 were victims of violence, compared to 15.9 out of 1,000 men. So, sorry about that. Studies have found that women are more likely to use dissociation and isolation to cope with trauma, whereas men are more likely to externalize and exhibit aggressive behavior. Again, this may be because of reactions to specific types of violence experienced. People who survive domestic violence are also similarly at risk of trauma and negative health outcomes. We're not just looking at the experience of community violence. Complicating experiences of trauma and recovery, a survivor's safety may continue to be at risk after they experience domestic violence. And if a survivor's social support system is comprised primarily of her abuser or others that might be supportive, that complicates the experience of trying to become safe again. The survivor may face difficult choices if she wishes to maintain her community. And research shows that survivors of domestic violence have a greater likelihood of depression, post-traumatic stress disorder, substance use disorders, self-harm, suicide, and other mood disorders. I'm going to pass it over to Sam to talk about the role of policy and history in the issues of violence, trauma, and poverty.
Thanks so much, Katie. Let me just check my phone to make sure I'm not on mute. Okay, I think we're good.
Hear you.
Okay, great. So I think as everybody has observed, as Katie's gone through, much of the data we see in Illinois is we can't really get around the disparate impact that violence and poverty have on communities of color. And as you really look at what that means kind of year after year and how we build policies and solutions, it's really important to understand the history that's created that, and that we've institutionalized racial disparity in many ways. I do encourage everybody to look at last year's report as well, where we did take a kind of deep look at racial disparity and poverty and the history of policies, redlining to drug policy that have created systemic barriers for communities of color. In this report, we thought it was important to really recognize how in the United States, both societally and the government have contributed to violence against communities of color and provide that context. Next slide. So I'll just wait. There we go. So if we think about U.S. history, we have a long history of using violence to control people of color. From slavery to today's use of the criminal justice system, we have created barriers that are not just barriers to getting ahead, but barriers that really mean the experience for many people of color has been one of experiencing violence at the hands of other Americans or at the hands of the government. The regime of slavery itself was upheld through violence at the hands of slave owners and the law, laying the groundwork for this history. We also see this Native Americans were violently expelled from their land and slaughtered from, excuse me for coughing, from the first contact with white explorers. Racial violence has been used by communities to control individuals throughout the civil rights movement. And today, we really see this playing out as we think about our criminal justice policy and reentry and what that means. Next slide. One of the things that we've been thinking a lot about at Heartland Alliance is what it means. I think there's wide recognition about the disparate impact of our criminal justice system on communities of color. What we don't often talk about is what that means for the individuals who are incarcerated, what that means for their families, and how violent that experience really can be, and what the collateral consequences can be for individuals impacted, including the children of those who are incarcerated. So if you think about some of the key tools that, or key problems that we hear about in our criminal justice system, we know that if we sentence somebody to go to prison, in Illinois, we still have solitary confinement. By many organizations, this is considered a human rights violation. When we sentence somebody to be incarcerated, we may be putting them in the way of a human rights violation. The same thing is sexual abuse, physical abuse, particularly against the mentally ill, run rampant in prisons throughout our country. we don't really talk about our correction system as being something that puts people in the way of violence, but the trauma of being incarcerated is a piece of this conversation. In addition, we have a criminal justice system that disparately impacts communities of color across the board. Let me just pull up my notes here. Significant racial disparities in the criminal justice system at every step of the way exist. In Illinois, Black people are 7.5 times more likely than whites to get arrested for marijuana possession. Black people are 9 times more likely to get arrested than white people in Illinois. And in Chicago, an estimated 43% of Black men, 45,000 people, are missing due to incarceration or early death, leaving behind families and communities with reduced earning potential, missing caretakers, and grief. Criminal justice involvement also has an effect on children of people who are incarcerated, including an increased risk of poverty and homelessness. And across the board, we see collateral consequences that get in the way of people getting ahead. So if I am somebody with a criminal record in Illinois, it means that I face well over 500, I think it's more like 1,100 employment barriers because of that record. In addition, we know that landlords, volunteer opportunities, housing, many of those things are all determined, or your opportunity to participate in them are often determined by whether or not you have a criminal record and the nature of that criminal record. So the institutionalization of this kind of disparate impact on communities of color means that each day we go further, we're widening that gap of opportunity for communities of color. And that those same drivers that drive poverty and where we see this deep inequity are the same drivers that drive violence, particularly in communities that are impacted. Next slide. So my job at Heartland Alliance is to try to look for solutions to a number of the systemic barriers that we see for the people that we serve. And it's really difficult to kind of get our heads around the problem of violence and of poverty. And these are big issues that often come with a price tag. And so as we move forward, next slide, in terms of thinking through solutions, many of the things are things that make common sense. We need to invest in programs that address trauma, that connect people with jobs, that address affordable housing, that promote education and employment, after-school programs and reentry programs. But all of that often comes at a price. And so one of our jobs as advocates and voices in this community really is to recognize that many of these solutions are long-term. It's super easy for me or anybody else to say we need a change to a very a change today because this crisis is so significant, particularly in Chicago. But what we lose when we move forward on short-term solutions are long-term effects, and we also run the risk of creating the sorts of policies that have created the racial disparities and the economic disparities that we've seen in the past. One of the things that I tell legislators is I really hate legislating by anecdote, and oftentimes our gut reaction, something needs to change today, leads to a solution that's not based in evidence and not based in the sorts of deep investments that we know through experience create long-term change. That includes really thinking through what our approach is to the criminal justice system, thinking through how we create opportunity in jobs and employment, addressing affordable housing. We are now still in one of the most precarious rental crises this country has seen. And we talked about before, at both the federal and state level, making sure that we're investing in a responsible budget that supports the solutions that create long-term change. Next slide. Katie, I'll have you talk a little bit about our website and the local resources.
Sure. I just wanted to put this out there, especially for those of you who are working in Illinois. In addition to the narrative report that we put together, we also compile a broad range of local level data on poverty indicators, not just the poverty rate, but these more in-depth indicators of well-being like high school graduation rate or teen birth rate or child poverty, housing indicators. And we have that at the county level for all counties in Illinois. And within the city of Chicago, we have it at the Chicago community area level, which is the equivalent of neighborhoods in Chicago. So that can really help you understand what the needs are in your community and to make the case for increasing anti-poverty resources. So please go to heartlandalliance.org/poverty report, click on the data tab, and there's a whole wealth of resources out there. And if there's something that you can't find, we might be able to help you with that. So feel free to reach out if you have any further questions after this webinar or other data requests. But that is the end of our presentation, and I'll hand it back to Maggie.
Great. Thank you so much. Can you hear me, Katie?
Yes.
Great. Thank you so much, Katie and Sam. I also have a collaborator of mine at United Way who helps manage the Illinois ACE Response Collaborative with me, Alex Murphy, who manages the health portfolio at United Way, and will be helping to moderate some of the questions that you have. So please feel free to ask questions along the pane right now. Something that go ahead.
I don't think anyone was saying anything.
Okay. So one of the things that Sam was mentioning was the 11,000 barriers to employment. That stuck out for me. Can you expound on that a little bit?
Yeah, and I think it was more like 1,100, excuse me.
Okay, thanks.
Although I will say nationally there are about 45,000 barriers to employment, housing, public benefits, voting rights. So there's a conversation right now about the role of collateral consequences. Collateral consequences, for anybody who is unaware, are the consequences of having a criminal record that are unrelated to your sentence. And, you know, for me as somebody who kind of wants to be a rosy-cheeked lawyer, it's really upsetting to think about if somebody has been convicted of a crime and sentenced and has served their sentence. On the other end, we shouldn't necessarily have these lingering tentacles once somebody's completed their sentence. Nonetheless, we do. And so there are kind of two separate ways that this manifests. On the one hand, you have kind of discrimination or use of a criminal record without any kind of law or policy being involved. So I'm a landlord, I pull somebody's background check, I see that they have a felony retail theft conviction from 25 years ago, I decide I do not want to rent to somebody with a felony, even though that likely has nothing to do with their ability to be a decent tenant, and I just choose not to rent to them. On the other end are the series, and this is where the 1,100 comes from. And if anybody's interested, you should look at the ABA has a collateral consequence website, and it's searchable by your state, by the type of collateral consequence you're looking at, it'll help point you to kind of figure out what all these barriers are and take a landscape look. But this other end is really where the state has gotten involved in limiting opportunity for people with criminal records. So for example, last year I worked on a package of legislation, including ones that removed a lifetime barrier for people with any sort of drug conviction from working and ultimately volunteering at a school. And so that means if I have a 20-year-old drug conviction, I can't be a volunteer at my child's school, and it wasn't even for teaching, it was any position at a school. I can't work in the cafeteria. And we realized that in many communities, schools are a big employer, and this was getting in people's way. So we were able to change that law, but the point is that's the sort of sweeping collateral consequence that keeps people with criminal records from being able to achieve meaningful employment oftentimes, and just feeds into this cycle of poverty and lack of opportunity. And as we know, and Katie, you can kind of build on this a little bit, access to jobs, particularly for younger people, really is a key in also kind of addressing those drivers of violence.
Yeah, definitely, Sam. A lot of the research we found shows a strong connection between employment opportunities and especially job quality and the rates of violent crime. You know, as wages go up, violent crime tends to go down, especially wages for men who may not have a college degree. So there's a strong case to be made that investing in employment opportunities and job quality will do a lot to reduce the rates of violent crime.
Great, thank you. This is Alex with United Way. We have a next question from someone in the audience that says, what would you say are next steps for clinicians and community advocates to help make a difference? And perhaps if you could prioritize those next steps.
Katie, you or me?
Sure, I'm just mulling it over for a second. I mean, I think in terms of our research, you all are, work on ACEs as part of your job. You're well aware of the role that trauma plays in the lives of people that you serve. But I think just having a broader view about how trauma affects their life prospects beyond just, in a clinical way, but in terms of how it affects employment, housing opportunities, and what is available to them beyond that. And also, Sam, maybe you could talk about policy opportunities that were related to our poverty report.
Yeah, I mean, I think if you live in Illinois, the first thing we need is a state budget because that will allow us to invest in many of the solutions that we talk about, and we can talk about criminal justice reform as well. But I want to talk about two kind of pieces where how you use your voice, I think, is important. And so wherever you're interacting with decision makers, I challenge you to kind of do two things. Focus on those long-term solutions. As somebody who spends a lot of time as a legislative advocate, I do get really frustrated that where we make policy change is because people are saying, I need you to change this tomorrow. And that's why things like increased sentencing has made politicians feel good, because they can say they're doing something and being tough, and it gives them a soundbite for today. The solutions that work are things that take time often, and as a result, people are less likely to give it that time because it goes outside of that political cycle. But if you are asking for those solutions, that changes the dynamic. The second thing, in terms of how we think through the criminal justice system, and I think, Health and Medicine has been thinking a lot about kind of reentry, is push back when people are trying to make distinctions between violent and nonviolent convictions, particularly when we're talking about collateral consequences. People who have committed violent crimes are parents. There are people who oftentimes have a similar history to somebody with a drug conviction. The reason that they have a violent conviction is often very, very similar. And there's not really a lot of data to back up. In fact, recidivism is lower for people with criminal convictions for violent crime. But so often when we move forward, people will say, well, I'm fine with that, but not with somebody with a violent conviction. You know, I'll rent to somebody who has this sort of conviction, but not a different one. And the result is a sort of kind of NIMBYism of opportunity where we really are making these false distinctions. And as we talked about earlier, so often people who do have a conviction for a violent crime are also themselves recovering from trauma and experiencing violence. And so use your voice to push back on those sorts of false dichotomies.
I just want to reinforce Sam's point that oftentimes the victims and the perpetrators of violence are the same people. You know, social network research has been done in Chicago looking at gun crimes and looking at non-fatal shootings. One study found that 70% of the victims and perpetrators were in first or second degree networks, and that means they either knew each other directly or were friends of friends. So when you think about the effects of trauma that people grow up in neighborhoods that lack opportunity and have concentrated rates of violence, it means they're more likely to either experience or witness violence as a child, which has traumatic effects, which we detailed earlier. So it's complicated when you're trying to, you know, look at these distinctions, but I think, you know, oftentimes there's not a clear distinction between the victim and the perpetrator.
Great. This is Maggie again. Marlita, I've unmuted you to ask your question. Marlita White from the Chicago Department of Public Health. Can you ask your question, please? We'll see if this works. If not, I can answer the question for you. Okay, Marlita has asked, since Illinois banned the box, do we have any data that speaks to the impact or the changes, good or bad?
So,
Can you explain what ban the box means to the rest of the group?
Absolutely, but then I have to give a plug for my bill. I'm just saying. So banning the box, there's been a movement throughout the country to kind of, I think more properly it would be called moving the box, to remove the criminal record question from a preliminary employment application. So for private employers of a certain size in Illinois, an employer cannot ask on the initial employment application whether or not somebody has a criminal record, and has to postpone any inquiry into that until kind of the time of an interview or offer, that sort of time period. And the city of Chicago has had, you know, kind of similar provisions for a long time, and it's been a movement throughout the country. There's actually been, I don't know that there's been kind of a deep dive into what happened in Illinois. What we have seen is some varying opinions about how effective the policy has been, but where it hasn't been, where people have been concerned that it hasn't been effective, I think the concern has been that then people were, I'm going to be frank, that there's been some concern that people were using a criminal record as a proxy for race, and now they are using names or other things that testers have seen that people, when they discriminate based on race, use as a proxy to keep people out. And so that is kind of, you know, the continued racial disparities and outright discrimination that we see in our country underlies some of these policies. That said, the National Employment Law Project has recently talked about how important the movement has been in creating job opportunities throughout the country. And in Illinois, we're leading the way in terms of education. So we are working on legislation to ban the box, and we would entirely ban the box so that you could never ask, no matter what point you are in the application process. Ban the box in higher education. We know that about 3/4 of universities, this is for public schools, ask about somebody's criminal record. There's no evidence that a criminal record does anything for public safety on campus. There is evidence, however, that even asking the question, no matter how great the process is, keeps students from applying. And so we know that this is keeping people from pursuing an education. For folks with criminal records, connecting with an education can be one of those things that helps kind of rewrite the long-term consequences that we've seen, that we talked about earlier with employment barriers. And so I encourage all of you to support that piece of legislation in the Illinois Senate. Hopefully, you know, the Illinois Ban the Box law is only a couple years old. Hopefully we'll have deeper data in the future.
Great, thank you. We have another question that asks, is there a correlation between gentrification and the increase in violence? How can we combat this process to provide specific opportunities in these environments?
I can speak to that. So I haven't looked exactly at gentrification and the relationship with violence. However, there is a lot of research looking at neighborhood characteristics and the correlation with violence, and not even correlation, looking at issues of causation. So one study found that if you look, Robert Sampson has done a lot of these studies, but if you look at neighborhoods with high levels of social ties and also concentrated wealth, which, you know, could be a sign of gentrification, they have much lower homicide rates. They're much less likely to experience homicide. And I think, you know, supporting affordable housing opportunities and promoting integrated communities, instead of creating these resource-poor, highly impoverished communities that, you know, have, you know, poorer schools, they have older housing stock that have more likely to have lead in them, they have slower police response times, could go a long way to reducing violent crime. And I think so promoting integration and affordable housing has an effect which people might not necessarily think about when thinking about ways to solve violence.
Great, thank you. Okay, then I think this is going to be our final question, and we'll wrap up. Could you please revisit the ways that a history of violence or trauma impacts work security in the long run?
Sure. So I think a lot of the ways that trauma influence employment outcomes, there's studies that show that people who've experienced trauma in their youth, you know, make less money as an adult, are less likely to have full-time employment. So I think there's just a body of research out there that shows a strong correlation between wage, likelihood of employment, and experiencing trauma in their youth. And if you take a look at our study on, trying to find exactly where it is, but there's a section under changing the conditions at the end about employment, and that really, you know, has a collection of these studies that you're welcome to, I invite you to peruse.
Great, and we know through our ACEs research as well that people with a history of even just the 10 ACEs that we saw beyond some of the other forms of trauma impact missing work days, how productive people are at work, and things like that. We know that through data that Illinois is collecting right now.
And I think also looking at survivors of domestic violence has an interesting view on this as well, because, domestic violence survivors tend to have high unemployment rates, and their traumatic symptoms make it hard to maintain employment, but also the actual abuse itself can interfere with the ability to maintain employment. So, we found in Illinois in 2015, almost half of domestic violence survivors in Illinois had a monthly income of $500 or less. And almost 2/3 were either employed part-time or not employed at all. And if you think about the effect of poverty on people's ability to leave an abusive or dangerous situation, that's quite concerning.
Very concerning. Okay, well, clearly this has been a wealth of information. I highly suggest that you go to Heartland's website to get the report. We'll also be sending it in a follow-up email, a link to that report. We encourage you to reach out to Katie or Sam if you'd like to get involved in their policy work. And please reach out to me to be involved in the Illinois ACEs Response Collaborative. We look to make systems level change based on practice learnings in the education, justice, and health spheres. And we also are looking to build community capacity, to build resilience. So you can look at our page at the Illinois ACEs Response Collaborative below. Again, these resources will be sent to you in the follow-up email after this webinar is completed. So thank you to our presenters, thank you to the audience for your questions, and thank you for all of the research that is being done to highlight the injustices and the policy solutions that we can all support to have a more equitable society. So thank you everyone, and have a great day.
Thank you.